Are smoothies actually good for your liver? Or could they be making things worse? That depends entirely on what you put in them. And if you have fatty liver disease, getting this right really matters. Fatty liver disease is surprisingly common in the UK. It affects a substantial number of adults, particularly those living with obesity, type 2 diabetes, or metabolic syndrome. You might hear it called NAFLD or the newer term MASLD. Both refer to the same condition where fat builds up in liver cells. It often causes no symptoms at all in the early stages, which is exactly why diet and lifestyle changes are so important before things progress. The good news is that dietary modification is one of the main tools we have for managing it, and thoughtfully made smoothies can play a supportive role, but only if they are built the right way. So, what does a liver-friendly smoothie actually look like? Start with vegetables, not fruit. Leafy greens like spinach and kale, or cruciferous vegetables like broccoli, should form the base. These provide antioxidants and nutrients that support metabolic health without loading your liver with sugar. Fruit should be limited to around one small portion per serving, roughly 80 grams. Here is why that matters. When you blend fruit, it releases what are called free sugars. The NHS advises limiting combined fruit juice and smoothies to no more than 150 millilitres per day, and they count as only one of your 5 a day, regardless of how much you have. Fructose, the sugar found in fruit, is mainly processed in the liver, and in excess can contribute to liver fat and worsen insulin resistance. Add a source of protein, Greek yogurt, silken tofu, or a small amount of nut butter all work well, and include a healthy fat if you can, such as a little avocado or ground flaxseed to support overall nutritional balance. Think of your smoothie as a meal replacement, not an add-on. Drinking one on top of your usual meals adds extra calories, which works against the calorie-controlled approach that underpins fatty liver management. Now, what to avoid, and this is just as important. Do not add honey, agave syrup, dates, or fruit juice. These all contribute excess fructose, which can be converted to fat in the liver. Avoid using multiple fruits in one smoothie, and steer clear of anything marketed as a liver detox or cleanse. Smoothies are not a treatment for fatty liver disease. They are one small part of a broader dietary approach. It is also important to know when to seek urgent medical attention. Contact your doctor promptly or call 999 if needed. If you experience yellowing of the skin or eyes, alongside other concerning symptoms, swelling of the abdomen or ankles, confusion or drowsiness, vomiting blood, black tarry stools, severe abdominal pain, or unexplained weight loss. And remember, liver blood tests can appear normal even when fatty liver disease is present, so a normal result does not rule it out. If you have been diagnosed with fatty liver disease or think you might be at risk, speak to your GP or a registered dietitian before making significant changes to your diet. This is especially important if you have type 2 diabetes and take insulin or certain diabetes tablets, as changes to your carbohydrate intake can affect your blood glucose levels and will need to be managed carefully. To recap, smoothies can support liver health when they are vegetable forward, low in fruit, and include protein. But they are not a cure. Excessive sugar, even from natural sources, can worsen fatty liver disease, and any dietary changes should be discussed with a healthcare professional first. If you found this helpful, leave a comment below. We would love to know what topics you would like us to cover next. And if you want more evidence-based health content from Bolt Pharmacy, make sure you like this video and subscribe so you do not miss what is coming next.